Let's take a look at how you might use the message center more efficiently. For confidentiality, you'll see some black boxes on these videos. That's to block out patient names and so forth, because there's not a really good way of doing this with fake patient data. So this is some real patient data, but we'll block out the names for confidentiality. As you're probably aware, there are multiple different folders over here, or filters, to show you the different kinds of things that are available in your message center. You've got results at the top, which are often broken down into categories like critical, abnormal, normal, other. You've got this results FYI. You've got a documents section, an orders section, and then a messages section. Sometimes you'll also have some items down here in the reminders. So how to think about these things? Of course, results is pretty self-explanatory. This is where things come that are results of things that you have ordered or have been ordered on your patients. Typically, you see things like imaging studies and labs. That's what we mostly see in the outpatient setting. Results FYI is a section where you will see things that have resulted in the hospital system for patients where you are assigned as the PCP. So basically the idea is that if one of your patients has to go to the ER and let's say has a CAT scan done or something, this way you're aware that that was done. It can be useful. Sometimes there are plenty of patients, of course, who are assigned to you that you don't really know. And so we'll look at that a little bit. We'll see what's in my results FYI section. Documents is kind of a mixed bag of lots of different things. There's these two main categories, the review and the forwarded documents. The review documents are usually things that have been scanned into the chart, so there can be quite a lot of different things in there, from consult notes, notes from a physical therapist, or often I will see prescription refills that were faxed to us still, unfortunately, instead of coming in down here where we want to see them as electronic requests. And then forwarded documents, this tends to usually be where you get things sent to you that need to be signed off from another user inside Millennium, although we can also see some other things there sometimes. But usually these are things most of us as in the faculty see our resident documents forwarded here for us to sign off. Also, you'll see physical therapy evaluations that come in that need to be signed off in there and other things like that. Cosign orders is the next section here that you see. The most common place we see these is when we're working with residents and the residents do an order and they need to be co-signed by the faculty member. There's also sometimes when a referral coordinator or someone in your office will put in an order and it will come to you to be signed off. And we'll show you how to do that. That's actually pretty easy in this system. Messages can be some of the most important stuff, but it's an interesting mixed bag because you've got the electronic refills that are kind of filtered out at the bottom, which are pretty self-explanatory. We'll go over how to do that workflow. But also the general message tab here. This is often the most important thing because most of the time this is where you have your messages that are actually taken by a human. So when your patients actually call in and talk to a receptionist or someone who answers the phone at your office and they take a message. So in general, one of the things you might want to think about is that when you come to your message center, you may want to check your general messages right away, because this is where the things where people have relatively urgent requests are often going to be sitting there. You may see something here that says, urgent medication refill request or what have you. And then you can deal with that right away. And then you can come back and take care of all the other stuff. Or if you are like me and you're a little bit OCD about your inbox, you just start at the top and you don't finish until you get all the way at the bottom. And there's some tools in here to help you do that, and I'm going to go show you that next. So when you get these items in your results and you double click on the item, you will get the actual result here inside a little peek at the patient's chart. There's a lot of things you can do here to take a look at what's happening and refresh your memory what's going on and what you should do with it. One of my favorite tricks inside the results is switching from this inbox view to the summary view. And so right here, the default view is the inbox view, and that shows you the whole result. But not uncommonly, I'll see a result and I don't remember the context of the result. Maybe I don't remember the exact patient, or I don't necessarily remember why did I order this particular test. Especially when you get a whole big wall of lab results, it's good to be able to remember, is this a diabetic, or, what was I doing when I ordered these things? So it's pretty quick. You can click on this summary view and you get a nice peek into the patient's chart. You've got a lot of things visible right here: their chronic problem list, their medications, their allergies, when had they seen you, some recent labs. The most important thing I find over here is the document section, because I can see really quickly, I can find the most recent visit with this patient. I can see that I saw this patient 3 months ago. My name is here on a clinic note. I can even just filter this out to only see my notes if I want to. But I can just click on it and it will open that note that fast. And I can get right down to my assessment and plan, and I can see, okay, I ordered these labs because this patient had some swelling and has hypertension. And so that's going to refresh my memory really quickly. And so I'm going to do a much better job of responding to this patient's labs appropriately, because I can pretty quickly get in here and see why I ordered them. To get back to the lab, I just click back on the inbox view, and I'm right back here looking at it. So you have that same functionality if you're looking at blood work as if you're looking at imaging studies. So here's a blood work example, and I click on the summary view. And again, here's my last note with this patient just 3 days ago. I do actually remember this guy. He's here for a physical. I can scroll down really quick and look at my assessment and plan. This guy is pretty unremarkable, just a healthy guy here for a physical. So that's going to remind me that if I go back and I look and I see that he's got some abnormalities in his glucose and so forth, this is important, and I need to make sure the patient understands the results. This isn't just a diabetic who is well controlled, as you may potentially think, seeing someone with a slightly elevated A1C. This is important, and so being able to quickly put these results into context, I find to be very powerful. So try using that summary view on a regular basis if you're not really remembering exactly what's going on. Often, even if I'm pretty sure I remember who the patient is, I'll pop out there and look anyways, because it just makes me that much more efficient and better at responding to the patient's results. So now that you know how to quickly get in and catch up on your context for your results, the next question is, how do you actually deal with them? So once you've opened the item, you're going to see the action pane at the bottom. You've got the action pane at the bottom of most of the items here in your message center. The top things in the action pane are the actions that you are able to perform for this item. So for results, I can endorse them, I can save them, and I can refuse them. These don't always necessarily make sense just on the basis of the title, so let's go over them really quickly. Endorse is meaning that you're going to sign off on it. So once I endorse it, it's going to remove itself from my inbox, and it will have basically a date and time stamp that says I endorsed it at this date and time. So that's kind of like signing it off, if you think of maybe the old paper chart type of workflow. You're signing off on that result. Okay. Saving will save this item. It will stay inside of your inbox. The reason that's important is because you can add a comment on here by typing or dictating something here into this box at the bottom where it says comments. And if you click on save as your action, when you do your OK button down here, it's going to save that comment to the item, but it will also save the item inside your inbox. So I find this extremely helpful when I'm trying to contact a patient, but I'm playing phone tag. So let's say I really want to talk to this patient about her chest x-ray, and I call her, but I'm not able to get a hold of her. Well, I still want to document that I made that effort to call her. So I can just type something in here like called patient, or attempted to call patient, no answer, or just no answer, something. And then if I change this to save, and when I hit one of the OK buttons, that will save that comment onto this item forever. So let's say for every day for a week, I try to call a patient and I can't get a hold of her. And then finally I send this off to someone to send a certified letter. And then let's see, the next week the patient complains, how come you never called me? Well, there's clearly going to be documented evidence that I tried to call that patient. And what's nice is when you do it through this, it automatically date and time stamps it for you. So that's really nice. Refuse is a little more obvious. So this is usually what's used when this item doesn't belong to you. So every once in a while, of course, the system's not perfect. especially since we work with residents a lot and orders tend to get assigned to different attendings for different reasons, you may find that this item doesn't belong to you. And one of the ways to deal with it is to click on refuse. Now, if you know who it belongs to, you can reassign it. So you click on this little, you see this reason popped open, and I can assign it to another MD. And then what I would do is the next step, which is additional forward action. So when I'm going to assign it to another MD, of course it doesn't have to be an MD, of course, but another provider, and then I'm going to send it to them to sign it, because now they need to sign it. This is where I find a little frustration here, because we've got the word endorse here, but the word sign here, even though it's referring to the same thing, but that's what that means. And then over here in this box, I'm going to pick the name of the other doctor that I want to send it to. And then when I hit OK, it will, because I have refuse as my action, it will drop out of my inbox and it will go into that provider's inbox. Now, sometimes you can't tell who it belongs to if the system is really bad and it sent you something you're not sure what it is. There is a thing you can send to called the refusal box. And I always remember HIM, which is Health Information Management. And if you send it to them, then they'll do the research to figure out who that actually belongs to, and they'll send it for you. Okay, so that's what you can do with these two, either the save or refuse. Remember, when you click on those, that action happens when you hit the OK button, one of the two OK buttons. There is also a next button. The next button is just going to move you on to the next item. It won't do the action on it. So the OK is what does the action, and then close will take you back to your list. Next will just automatically take you right to that next section. So remember how I said I like to just roll through all the items. I'll click this OK and next, and boom, I just go right on to the next one. So hopefully most of these things are actually belonging to you, and then you're going to click on this endorse button or leave it clicked. It's the default when you open the item. And endorsing, again, is signing off on it. That means this is a good result and you've taken care of it to what you think you need to do. Now, what do you need to do with it? Of course, this is kind of the art form of medicine, is how do you respond to normal results or abnormal results or what have you. And so you can do many things, of course. Call the patient yourself and talk to them. Through the summary view that we looked at earlier, there's another tab right here called demographics. If you don't have that tab, just click the plus and then you can turn on the demographics. But what I like about this is that the patient's demographics are really easy to get to, so their phone numbers are all listed right there. Okay, you probably can't see the phone numbers because of the black box, but believe me, the phone numbers are there. So that's under the summary view and the demographics. But coming back to this, what else can I do with it? What do I typically do? I usually am going to use my medical assistant to really help me out here, because honestly, I don't have time to call patients all the time, especially when the results are normal or expected. You know, it doesn't really benefit the patient much by talking to them, and that's a big chunk of time it takes to call patients. Now, some doctors like to write letters for their own patients. Some doctors like to call all their own patients, and more power to them. I've just decided in my workflow I don't have time to call all the patients. Now, if someone has a really significant finding, let's say like a positive chlamydia test, or some really out of control diabetes test or something, I'm definitely going to pick up the phone and call those patients and document that I did so. But most of the time, what I'm going to do is I'm going to send a message to my MA and ask her to take care of this for me. So the way you do that, I'm going to endorse it. That's going to sign off on it, but I'm also going to make sure this additional forward action box is clicked. Now, I don't want to send it to her to sign because she's not the provider. That's for providers to do. So I'm going to pick one of these other items. There's a bunch of different items here which honestly are not that important. I almost always pick this one, the second one, call patient with results, C note. And then here's the area for the note at the bottom in the comments. And what I see a lot of providers struggling with in this section is thinking that they have to type in what's going on here. And you certainly can type in here, but the most important thing, if you're not doing it, is to build some auto texts here. I think that's really, really powerful. You can also dictate in here using drag in medical one if you want to, and that can be powerful too. You do have a limit on the characters. It only lets you go out to about here or so, but you usually can get a pretty good amount in there. But what I've done now is I've built quite a few auto text. And so I have this one, for instance, .NL X-ray, and this is directly for this workflow because I'm sending this message to someone. And here's the things that I've found to be helpful. So just some general ideas of how to phrase what you're doing here, and especially if you're using auto text, there are a couple little things to think about that make the auto text a little bit better. So number one, it might as well be polite, right? So you'll see I use words like please and thank you when I'm doing my messages. You know, I know this is a lot of work I'm asking her to do, and even though she's happy to do it, it doesn't hurt to have a please on there. So I'm trying to be polite. And I also just want to tell her exactly what I want her to do. So Elisa is my MA and she's fantastic, but I don't want her to have to make any kind of interpretation on what's going on here. So I want to tell her specifically exactly what I want her to tell the patient. I also going to tell her what I want her to do. So in this case, I have written, please let the patient know the radiology report was normal. Now I've spoken already with my medical assistant, so she knows what I mean when I say this, because you can see there's some specific terminology here. I wrote, please let the patient know. So I didn't write, please call the patient. I didn't say, please send the patient a letter. So it doesn't matter to me how she lets the patient know. That's basically why I've used that generic terminology. And typically what she does is she'll call the patient a couple times. If she can't get a hold of them, then she'll send a little note. But this allows her to have some flexibility in how she contacts it. Now, if it's something I really think she needs to call her, then I'm going to change it. And I'm going to say, please call the patient and tell them this. So you can be, somewhat specific when you need to, or you can be a little bit less specific when you can to let your staff work. But then you can also see that I don't have any gender language in this, so this makes it really easy because it doesn't matter if what gender the patient is. I said please let the patient know the radiology report was normal, so I didn't say let them know her report was normal or anything like that. So I've just kind of built a lot of these so that all I have to do is put in my auto text and go. So in real time, if I saw this, I would review this. I see that it's normal. I would put in my auto text, NLX, hit enter, and then I would OK and next. And since I have her already listed here, because the last thing I did was send something to her, she will be defaulted there. So I'm going to OK and next, and that's going to take me right to the next thing. So the next thing is some STI screening. I remember this patient, I saw him just a couple days ago. This one has that interesting gonorrhea and chlamydia result on it that results as a note. Now, if you're really careful, you will be able to see that it turns a little bit brown when it's abnormal, but I always recommend just click open that note and look at your results manually and make sure they're negative, because you don't want to miss one of those, obviously. But this guy's labs are normal, so I'm going to click on this additional forward action. I'm going to pick the second one down, call patient with the results, see note. I already have my MA selected because that's the default. And I'm going to type ... NLL for normal lab. And another really simple thing, please let the patient know the labs were normal. Not his labs or her labs, but the labs. So it might sound a little silly at first, but when you think about it, it just makes it much simpler for me. And then again, OK and next, and I'm on to the next one. Okay. So this is a relatively easy way to get through your results by being able to review the context, going through summary view, come back, put in what you think needs to be done, or take care of it yourself. Of course, if you take care of it yourself, you're going to put your comment on here and you're going to say, I called the patient and I discussed this with them or what have you. Okay. Now, next I want to show you what happens to the comments that you type in here. So we'll pull that up next and we'll take a look at where your comments go. Okay, now I've pulled up the lab results for another patient. I know this patient had just come in for a physical, so I'm going to review his labs really quick, and I see mostly down here what I'm concerned about. His A1C is slightly elevated and his cholesterol is a bit elevated. Okay, so how am I going to respond to this? Here's my response. Again, I'm going to have my MA call this patient and let him know what's going on by clicking that forward action, call patient with results. I already have her name here. If it wasn't there, I would just type it in and find her. And then I'm going to use one of my auto texts again. Now, I don't know about you, I have a ton of patients who have prediabetes on their labs, so I have an auto text bill for that, lab prediabetes. And it says, please let the patient know the lab showed prediabetes. They should work on low-carb diet and increased exercise and recheck labs in 6 to 12 months. So again, using the principles we mentioned earlier, I'm polite, I'm specific about what I want the patient to be told, but I'm allowing the MA to call or send a letter, and I'm using non-gender identifying pronouns like they. So that's it, and I'm going to sign off on this one. Now, what we're going to do next is we're going to go open this chart, and I'm going to show you what happens to those comments. Okay, so when I go to his chart, and we get to the results review of this patient's chart, I see those same labs that I just signed off on. And if I right click on there and I look at the details, I'm going to see the details, and you can do this for each of the individual items, but the important thing here is this action list. And the action list will show you all the little things that happen with this. So it actually shows when I ordered the lab, when it was in the lab. None of that stuff's really that important to me, but what I really want to see is this endorse. So this is when I endorsed it. Remember I said there's a date and timestamp. Here's the date and timestamp. And then what's even more important is that comment that I typed in at the bottom. It is attached to this, this item, and it will be attached to this item forever. So again, if I typed in here, I discussed patients' results and told them they needed to get treatment or whatever, if I type that in and save it onto that item, it will be there forever and you're going to be covered. So if there's any confusion in the future about how you responded to it, it's right there. It's pretty cool, and that's on any kind of item that you put a comment on. Moving on to the next section, we're now looking at the results FYI, and I can see that I have 2 discharge summaries here, or discharge documentations, and these are both actually patients of mine that I recognize. It's really not uncommon to see patients in here that I don't recognize because now that I've been in practice for several years, I have a lot of patients assigned to me who maybe don't see me or haven't come into the office yet, or often they're seen by a resident or one of the other providers in my office. In that case, it may not be that important to me, and I may just open that item and just sign off on it. Now you see the difference here, the actions. Remember when we looked at the results, the main action was endorse, because that's something that I'm supposedly responsible for. Here, because this again is an FYI result, I'm not responsible for it. So all I'm doing is reviewing it, or if it's really not appropriate for me to have it, I can refuse it. So the vast majority of the time, all you're going to do on these things is review them and sign off on them. Now you may open one of these up and see that there was an action on it that you wanted to take. This one is even actually just an anticipated discharge summary, letting me know that this patient was discharged, but the discharge summary is not even done yet. So clearly there's no action I can make on it. But perhaps you wanted to have someone at your front desk call the patient and schedule them for an appointment, or facilitate the patient getting a follow-up or what have you. So you could take action on it just like we looked at the other results by forwarding it to whoever you wanted to, put in your comment, and then dealing with it. So in this case, I don't need to have any action on it. I'm just going to sign off on the review. I'm going to hit OK and close. That takes me back to the list of the results FYI. There's one other item of interest for the results FYI section, and although I don't have an example to show you, it's good to know, and that's that we have the system set up for a pathology result that comes in through the hospital system. If it is for a patient that you are the primary care doctor, it will also go into the results FYI. So this can be nice if you had a patient who, let's say, got a colonoscopy and had a polypectomy, and you got there's a pathology report. It'll come in here and you're able to see that happened. Another example, if someone has a bronchoscopy and has a biopsy, So the doctor who does the bronchoscopy, the pulmonologist, is going to get that result in their regular result inbox, and they'll be responsible for signing off on it. But you'll get a copy of it as in the results FYI to let you know what's going on your patient. So again, you don't have to take action on it, but it can be something you want to have action on it, so you can write from that item like we looked at. Continuing from the top down here, our next category is the document section. And I think I mentioned earlier, the document section kind of is a catch-all, and there are a lot of different things that show up in here. Right now, currently, you can see I have some imaging studies that come from an outside imaging group, which is usually that Grove Diagnostics, like you see here. This is an X-ray report from a patient of mine. Now, I remember this patient, so I don't need to check the summary view, but if I wanted to, I could get there from the document section also, just like we saw in the results. You can manipulate the image, make it bigger or smaller, go to different pages, rotate it, and so forth if you need to. I can read this okay, and it's basically saying that it's normal. So again, I'm going to come down here and I'm going to take action on this. Now, actions for documents do not include endorse. You're just reviewing it or refusing it. I'm going to have an additional action, and I'm going to ask for a review, not a sign, and I'm going to send this to my MA again. And I'm going to put in a comment here. And again, I'm going to use my normal X-ray auto text. Now, one thing I just did here that you may not have noticed is that I just started typing in the first couple letters of my MA's name, and it came up there, and all I had to do is hit the down arrow and enter, and that selected her. The reason that works is because I have her as one of my favorites. So if you don't have people signed up, selected as your favorites in the message center, you're going to want to look into doing that. I'll make another video later to show how to do that. But it also really helps a lot, and it makes it easier to access the people that you message a lot. So again, for this item, it's an X-ray that's normal. I'm going to send my auto text asking my medical assistant to call the patient and let them know it's normal, and then I'm just going to sign off on it. So I hit OK and close. It takes me back to the list of things. Let's see what other documents I have in here. Sometimes you'll see these messages that are a reminder message, and so what happened here is this is the way it gets documented from the nurse's perspective. So you can see that this is a patient that I worked on a message a few days ago, and this is one of my auto texts. I let the patient know that lab showed prediabetes. The MA actually types this in, and so she makes a record that she spoke with the patient and the patient understood. Typically, that's all that happens with it, but you can see in this case, this patient actually called back later that same day and spoke to a different staff member, and then said that he had some other questions, so he wanted me to call back. So in this case, I'll need to call this patient back. After I call him, I'll put in the comment here that I discussed with the patient or what have you, and I'll sign off on it again. And again, like I said, the nice thing about these kind of comments is everything is saved. So even down the road, worst case scenario, if you need to defend yourself about what happened, you will have documentation of all these things, and you will be able to clearly state what happened because everything is date and time stamped. So I think it's very important to type a little comment on it. Maybe even something very simple, but for the most part, it's good to put a comment on results or things like that you've ordered, just so that it's easy to know how you responded when you got those. One other trick that I found useful sometimes in the documents section is being able to access specific parts of patients' charts relatively quickly. So I especially like this when I get a scanned in medication refill request. So I don't have one right now, but if this was a medication refill request for this patient, such as one that gets faxed sometimes from the pharmacy, I can get right to the patient's medication refill page by clicking the little drop down next to the patient's name. That's this blacked out part here. But when I click the down arrow, I get all the different components of the patient's dark menu, if you will, from inside the workflow. So I can go right to the medication list, and then I could find the medication that's being requested to be refilled, and I could renew it. So that's a pretty quick way of being able to get through medication refills, even if they are faxed. You get right there, and then I just click back up here on Message Center. It takes me right back where I was, and then I can sign off on that item and move on. The next category in the document section here is the forwarded documents. This one I have here is the reminder message that we just looked at, but typically what we see here are documents that we get from some other user that need to be signed off. Most commonly, the faculty will recognize this as the area where we get our sign-off notes from the residents. When we get those, it's important to open them and modify them to go in and put your attestation. There'll be another video later on how to do the attestation, so we'll be able to review that together. Before moving on to orders, I'd like to show you where the comments go when you attach them to a document. We already looked at where the comments go when you attach it to results. You can go into the results review, right-click on it, and look at the details, and you'll be able to see where those are. With the documents, the scanned documents, it's a little bit different. So I'll show you how it goes. So once again, I've taken a look at this result. This is an MRI and it's normal. So I'm going to do my normal thing here, and I'm going to additionally forward action with review to my MA, and I'm going to use my auto text of normal x-ray. Okay, now I'm going to okay and close this. That'll sign off on it. And now what we're going to do is we're going to that patient's chart, and we're going to take a look at that item. Okay, so I'm in her chart, and scanned items, as you're probably aware, are in the notes section. So here is the MRI that I just signed off. Inside the notes section, external documentation, outside facility, and this is the MRI. And what we're going to do, which is totally not obvious from looking at it, is we're going to bring our cursor down all the way at the bottom of the screen here. And we get this little double line with a double arrow, and I click and I drag that up. Really weird, but this is where we start to see some of the details about this image. This document has an image that was scanned by this person at this time. Now, the really weird thing is that now I do that again. So I get that I'm at the bottom of the item with my cursor. I get that double line and double arrow, and then I drag it up again. And unfortunately, it often takes a few tries, even for me, and eventually you get it. So when you get it here, now this reveals again that action list. So the action list is the same thing we had gone before earlier to look at on the lab results. Here's that action list, and it shows when I reviewed the item with the date and time. And yet again, here are my comments, and they're attached to this item forever. So I know it's kind of a pain in the butt to get in there, and really you don't need to do this on a regular basis for any reason, but I want people to know that those comments that they type in on items that are scanned in or on results, they are attached to that item forever. So this is a good practice to have. Type your comments in because they're saved forever for you. I can actually speak from experience, having done a couple of depositions. It's good to have these things on here because if you ever need to defend yourself in the future, having even just something very simple like this on there goes a long way down the road to show that your documentation was complete and to remind you why you did it. So after documents, the next section is orders. And these are typically things that come in either from someone in the hospital working on a patient that sends it off to you to be signed off. So for instance, these the bottom orders here are from a resident patient that I was working with a resident yesterday on, and so he puts the orders in and he selects me to be the co-signer. Often we're also seeing these types of items here, which are coming from the pharmacy and are usually resident orders that when the pharmacist manages them, then they go to another faculty member to be signed off. So the easiest way to do this is just to select multiple things, or you can even hit select all if you're pretty confident to get rid of them. And then you can right click, and typically you're going to approve these. That's going to go one by one and approve them. Now, if you've got a whole lot of them, especially when they're medication ones, often it will stop and it will have some of those pop-ups about medication interactions and so forth. So you'll individually deal with those. and then let it go, and it will sign off on all of these. And this really varies depending on your position and where you're working. So when I'm working in the hospital with the residents on the inpatient team, I will have hundreds and hundreds of these, of course, because the residents are admitting, discharging, and managing the patients all day long, and they're doing orders all the time. And when I'm not in the hospital, I only occasionally get some of these. So fortunately, it's relatively easy to sign off on them. Okay, last but not least, the final section here that we're going to look at is electronic refill requests. And these usually, there are 3 different categories these can fall in. The ERX renewals category, and these are the ones that the system was able to successfully match the patient with the refill request that came in. There is another one that's called suspect matches, where the system thinks it knows which patient it is, but typically it needs you to select the encounter that you want to use. I don't have any of those to show you, but it's pretty straightforward. You just get the pop-up when you click on it, and you have to pick the encounter. And then the final type is this non-match, and that's where the system doesn't know which patient it is, most likely because something didn't match up. So it could be that the name is different, the date of birth is different. Usually really what it is that the address is spelled differently or something like that. So let's look at the workflow for this. I'm on my ERX renewals, and I'm just going to double click on the first one. Okay. Now, there's tons of information, of course, on this. I've got which pharmacy it came from, what the original prescription is, what the renewal request is. Now, I can do my summary view, and I can look at the chart again and look at some old notes. I can go into the chart itself if I need to. Now, I know who this patient is. It was a long-term patient of mine, so I don't mind refilling this. But if I knew this wasn't my patient, I could forward this to whoever's patient it is and then delete it. In this case, though, I'm going to go ahead and refill it, okay? So here are the details of what's being requested. They're asking for an 8.5 gram one, which for this inhaler means 1 inhaler, and that's fine. I'm okay with that. And they're not requesting any refills, which again, because this is an inhaler, I'm okay with that. So it's pretty straightforward. If I want to sign off on it, all I have to do is hit this accept all and next, which I can do. Now, there's also probably another one on here. So I could see that this scroll bar was there. Also, if I tried to accept it, it wouldn't have let me because I hadn't looked at the second one. So if I scroll down, I see the second one. This is for some Flonase. I certainly have no problem with this patient getting refill on this. And you know what? I'm actually going to approve more refills for this one. So the request was for 5 refills, 6 total, and I'm going to change this and say he can have 11 refills on that one. I'm feeling generous. And then lastly here is some loratadine, and here's the loratadine 10 milligram. Again, they're requesting 5 refills. Now this is an interesting one that the quantity is only 30, and you might think, what do I want? What can I do if I want to change something on here? So for instance, what I'm going to do is I'm going to edit this, and I'm going to send a prescription for 90 instead of 30. So you see the 3 buttons here. So each one of these individual items has the 3 buttons. So I could accept this request, I could decline reject the request, or I could change it. So not uncommonly I get the refill request, and it has the same thing twice. So I will reject one and accept the other one. Or sometimes I will get some refill requests electronically for controlled substances, which for now we can't refill electronically, so you'll have to reject those. But in this case, what we're going to do is we're going to do the delta, so we're going to change it. So it says replace. I'm going to click on it, and I can either change it to a completely different medicine, or in this case, I want to do the same medicine. I just want to change something about the dose. So I'm going to click that first one, and it should allow me to edit that item. So here's that item. And again, this is like an old prescription, so it didn't match. So I can say we're going to use 1 tab, oral and daily, and I'm going to do 90 instead of 30, and then I'm going to give him 3. Now, it's not going to allow me to change which pharmacy I'm sending it to, because remember, I'm responding to this pharmacy's request, but I've been able to come in here and change some of the details. So if I knew this patient was supposed to be on 20, or if there was a different dosing, I could change it up here and say, oh, they were only supposed to be on 5 or whatever. and I'm going to sign on that one. And this one, we'll go ahead and just sign that one off, and that one's gone. And now these two are good, so I'm going to sign off on those. And so I like this workflow because I can accept all and next, and it's going to send both of those, and they will be signed off, and it will immediately go right to the next one for me. And here's the next one. Okay, so the next one is for omeprazole. I know this patient also, so I'm not worried about this patient. I can get a couple refills on this, so I'm going to accept all and next. It's going to pop up with this. I got my last check on that prescription. Looks good. Moving on. So this is the non-match one, and so instead of going right to the refill, it's going to ask me to figure out which patient this is. And sometimes it's frustrating because it looks like it should match, but it didn't match. But anyways, we got to help the system out sometimes. So best thing I found to do, double check the name, check the date of birth. Usually those are the things that are most important for your matches. You've got things like address and so forth. Probably what didn't match in this case, this patient doesn't have a phone number in the pharmacy listed, so it didn't match because we have a phone number. So a little frustrating, but that's the way it goes. But I've clicked on the patient, that's the correct patient, and then down at the bottom I need to pick an encounter. Typically you want to pick one of these clinic encounters if you can, and then you're going to say okay. Now, since the patient is matched, it's the same workflow as before. This is another one of my patients that I know very well. I'm perfectly fine with her getting a refill on this, and I'm going to go ahead and accept all. If I accept all and next, it'll take me to whatever else I have next, which in this case would be back up at the top. So I'm just going to hit accept all, and I've got my clinical decision support here. So this patient is on a few different medicines that have possible interactions with it. I'm very familiar with her medications, so I'm happy with that. I'm going to do prescriber clinical judgment for overriding those, and I'm going to send that. And that's it. That's refill requests all done, and I'm pretty happy with that. This one, so I didn't move on to the next, so it documented what I did, but it left it in the box, so I just need to hit delete. That's why I like the accept all and next. It does all of that for you. This is the other way you can do it. So that's a quick look at how I like to work on my message center, some of the tricks that I've learned, some of the things that I've picked up along the way, some reminders then looking through this. If you're keeping up to date, start at the top, use your okay and next, and you should be able to get through this relatively quickly and deal with most of them. Remember down here for your comments, you can dictate, you can use auto texts. There is no place to make the auto text here though, so you do have to open the chart and then like go into your SOAP section and make the auto text there and then come back here and use it. That's a little weird, but that's just the way it is. Use your additional forward action. I encourage you to partner with your staff. Now, I would encourage you not to all of a sudden just start sending a whole bunch of things to someone that you've never sent things before to. Have that conversation with them. Hey, you know, I want to work with you on how we can better interact with our patients and figure out what works best in your workflow and in their workflow. So let me know if you have any comments about this. What other things do you use that you think work good in the inbox? There's a spot below the video to leave comments. I'd be happy to see that. I'm also be excited to see if there is something else you'd like to see next that I can do some more videos on.